Hello, and thank you so much, everybody, for joining. Today, we are so excited. We're going to talk about one of those topics that is top of mind for every single parent that I know, including myself, which is pediatric sleep. Yay! So, thank you so much, Dr. Kansagra, for being here today. I want to hear, first of all, about you and about your journey. So tell us what inspired you to go into this area, specifically pediatrics and neurology and sleep.
Yeah, well, it's great to be here. Thanks for the invite. So I'm a child neurologist by training, and for me, the brain was always very fascinating. Lots of mysteries, lots to be learned, and so I knew I wanted to study the brain in some way. And then pediatric neurology was just a lot more interesting and nuanced at the time that I was preparing for residency than the adult counterpart. So I decided to focus my energy on pediatric neurology. And then sleep in particular, I've always been fascinated by sleep. I'm an expert sleeper in many ways. I sleep very well. And I was like, maybe I should become a sleep expert and share some of that sleep related science with the world to get everybody sleeping better. Another great avenue to do research, to help people in clinic, but also just to spread education. So all those came together. And here I am as a child neurologist with an expertise in sleep.
Awesome. And you are right. I think that for adults, of course, sleep can get complicated for them too, but for kids, feels like such a mystery and it's so fear-inducing for parents. Tell me, what's one of the most interesting things to you about pediatric sleep, or what's one of the things that really drew you into this specific area?
Well, I always like to think that if you establish a good foundation for sleep, just about everything that is associated with a child's well being and their mental health, all of those things tend to improve. And similarly, if you have a challenge with a sleep problem that's affecting the quantity or quality of your sleep, we know that almost everything when it comes to health and psychiatric disorders, all those things tend to worsen. So it's a nice way of intervening to help a child with everything that they're supposed to do and all of the quality of life things that can help a child thrive. We know that sleep is incredibly important for overall development. We know that a lot is happening in the brain while we sleep, which is probably the reason why children sleep so much more. And my goal, just like you mentioned, is to make it not scary, make it something that's approachable with easy to access advice that are science based to help families and their kids get the sleep that they need.
Oh, I love that. And, I follow you on social media. I know you follow me. So much
Likewise, yes.
of this kind of balance on social media is not making it scary. And part of that is making yourself relatable and letting people understand that you're just a human being. Sometimes my team will say things like, really, do you need to dance around yet again on an Instagram post? And I'm like, yes, the people need that. Then they'll be entertained and then they'll listen
That's
to
right.
what I have to say. I saw a post that you put up that said, like, which of these do you think like hit harder on social media? This one where I was giving all these facts, or this one where I did like myths and truths and I was really animated and did funny things?
Yes, that's the nature of social media, which is great. It's an amazing platform. It has a huge reach, and there's no way of getting this type of reach when it comes to research articles and stuff that we publish. You can't get in front of this type of an audience. But at the same time, attention spans are very short. So I take a similar strategy, which is you got to entertain maybe like 60-70% of the time, and then sneak that education in there when they least expect it, and hope that it kind of sticks and lands for them.
Totally. So I think one of the things that actually Blueberry and you and myself are all aligned on is this idea of kind of meeting people where they are. I think that for a long time, medical professionals felt like, oh, they shouldn't be in this space. They shouldn't be on social media. They shouldn't be kind of in this like kind of common pedestrian area. But what's your take on that? Do you feel like people are able to take in the information more readily in these different channels?
Well, I always say that if we're not here, someone's going to fill up the space. People are
Yeah.
going to be on social media. It's not going anywhere anytime soon. And so I think it's our duty to be out there and helping make sure people understand science-based, factual content. Otherwise, we know on social media myths and untruths spread so much faster than actual true information. It's because it gets so much more engagement, whether it be positive, negative, etc. And so, I try to encourage more of my fellow colleagues to be out here, both discussing the research that they do and then helping fight those waves of misinformation that we know are so present on social media.
Yeah, I think we really actually have to be ethically. Now, not every single person in your practice has to be because some of us feel a little more comfortable than others. But I think that as a community, like you said, there is a vacuum that will be filled by other voices. And so it behooves us to be in that arena with everybody else. If we consider ourselves kind of too high and mighty or too ivory tower, or even I think in the advice that we give in the pediatrics office, or on the apps like Blueberry, if every single thing we're giving is not relatable or doesn't come to where people are, we're going to miss the boat. They're going to go someplace else where they do feel like someone understands them or they're just a person like them. So we really have a huge
That's right.
opportunity.
And
Yeah.
I take it like one step further with my colleagues, and I tell them that yes, you might be in this ivory tower writing research papers, but guess what? As time goes on, no one's actually reading your research papers.
Right.
I mean, the younger generations could care less about opening up a journal. They get all the information online, whether that be online journals or online
Yeah.
resources. And so, why not be there to point them towards those articles, towards that research, towards the science that's factual and evidence based? So,
Yeah, for sure. All right, so let's talk about the sleep itself because I'm sure people would love to hear about these theoretical discussions about social media, but they came for the meat, they came for the sleep info.
let's
Okay,
do it. Yes.
so let's talk about why sleep is so fundamental because I think that as a general pediatrician, I promote sleep, no pun intended, day in and day out to my patients. But it's one of those things that I think people can really overlook. They can kind of dismiss it as like, yeah, I need sleep. But you mentioned this a tiny bit. Go into how does it really, how does it affect kids developmentally when they have sleep deprivation, and how can it help
Yes.
them when they get enough sleep?
Yeah, there's a clear difference when it comes to sleep quality or quantity differences, adults versus children. In adults, we're used
Mm-hmm.
to the typical symptoms of I'm fatigued, I'm tired, I'm sleepy, I can't stay awake during this meeting, et cetera, et cetera. For children, sleep dysfunction is usually manifested with behavioral manifestations. So it can be inattentiveness, impulsivity, a hard time with emotional regulation. So it's really behavioral manifestations. And any parent will tell you that if a child has missed their nap, they're just not more sleepy the rest of the day. They are irritable. They're cranky. They're having a really hard time with that regulation piece. And so we're really looking for the behavioral manifestations. And yes, of course, sleep dysfunction can present with fatigue and other manifestations for sure. But the primary one that we like to hone in on is the behavior stuff. And that's why if a child has, for example, symptoms that might mimic ADHD, I'm always focusing back on, is there an underlying reason why they're having this experience or they're having these symptoms? And oftentimes
Mm-hmm.
it's due to lack of adequate sleep or something that's disrupting the quality of their sleep.
Yeah. And what are the things that you find tend to disrupt the quality of sleep or the amount of sleep most in American families? What are the things that either parents are doing, and I'm putting like quotation notes on that or quotation quote marks on it, because I know that most parents don't like aren't actively trying to get their kids to have less sleep. But what are the things that you're noticing in terms of habits or in terms of environment that are making it so kids aren't getting the quality sleep that they need?
It differs greatly based on the age, of course, but we know that for younger children, for infants, for toddlers, oftentimes a good chunk of them, and based on large epidemiologic studies, like 30 to 50%, can have difficulty with sleep due to behavioral insomnia issues. This could be stuff known as sleep onset associations, where they get used to having caregiver involvement for getting to sleep, and with every subsequent normal awakening. It can be due to limit setting in toddlers, where they're pushing those limits, which toddlers naturally do, thereby delaying their bedtime. When you get older, then we start talking about other sleep disorders, including sleep apnea. And so children are at risk of sleep apnea, depending on the study you read, up to 4% of the population can have sleep apnea. So one child out of every classroom. You can also have restless leg, which is something that's often overlooked amongst our pediatric population. Anywhere from 1% to 6% of children can have restless leg syndrome. That can also disrupt the quality of your sleep.
For those who don't know what restless leg syndrome is, talk about that for just a second. What is that?
Absolutely, yeah. So this is usually in slightly older children. We're not going to see this in infants and toddlers, but typically at earliest around 4 or 5 years of age. There are four main clinical criteria. It's an abnormal or an uncomfortable sensation in your legs. It's present only at night, or it's worse at nighttime. It improves when they move their legs, and it gets worse if they stay still. And like all of our other medical disorders, there shouldn't be another underlying cause, like you shouldn't have neuropathy, et cetera. And it should cause some sort of daytime dysfunction. And oftentimes for children, it's actually due to iron deficiencies. Even in adults, we really have to look at iron level first, because iron serves as an important cofactor in creating dopamine for our brains. And dopamine, we know as a neurotransmitter, is important when it comes to the development of restless leg symptoms. And so oftentimes it's confused with growing pains and sometimes kind of poo-pooed. And then 10 years later, when the child is older and more expressive, they're like, no, in their 20s, it's not growing pains anymore. There's something else,
That phase has passed. It is still
That phase is
persisting. I still
past
have a
and it's still
problem.
there. That's right. And when they go back and they look at these patients that have restless leg as adults, a good chunk of them, their symptoms started when they were children. They just weren't able to express it or wasn't recognized until much later in life.
So we have these behavioral issues, things that are habits, maybe attachments that we make, crutches. Sometimes people call them sleep crutches that people have,
Yes.
things that people need to fall asleep. And then if they don't have them, it's more difficult to fall asleep. That idea of whatever you fall asleep with when you're falling asleep, when you wake up naturally in the middle of the night, that if it's not there, like a parent, then it's more difficult to fall back asleep because we all wake up naturally in the middle of the night as part of our sleep cycles, right?
Yes. Yes.
And then we also have environment. How important is environment, and what are the environmental factors that can help kids get the quality sleep they need?
It's a great question. It's very hard to quantify on a research basis, but we know we encapsulate all the environmental and the behavioral factors in a big term called sleep hygiene. Sleep hygiene is anything in your environment or things that you do that can hurt or help your sleep. And we know that if you take a variety of environmental factors into account, we think your sleep quality will be better. And the main ones are some of the obvious ones, which is having a comfortable, calm, quiet sleep environment we think is important. We also know that temperature of the room can be important. Everybody has slightly different preferences, but the cooler side usually helps. 68 to 72 degrees is usually the range that we give because your body temperature needs to fall a bit when you get into those deeper stages of sleep. And being able to have those cool temperatures can help with that transition to deep sleep. There are children that naturally have tendencies like needing like some sort of sensory input. So for some older children, things like weighted blankets can be helpful. In some children, white noise machines can also be helpful. But I'm a bit of a purist. I like to say that if you can avoid everything, that's ideal.
Absolutely. So, okay, environment's one thing. We have behavior on the other side. And in my experience, there are lots of parents that come in at like that toddler zone, or maybe their kid is 4 or 5, and they haven't ever been able to sleep well. And they tell me like, I think it's too late for me. So tell me, is it ever too late to get your child on a sleep schedule that will help them to get quality sleep or to help them have more quality sleep if they are on a good schedule?
Yes, it is never too late. So I always say, even in adulthood, right? So some of us have had poor sleep for many, many years, and then we're adults, and those habits can perpetuate, and the sleep dysfunction can perpetuate. Yes, it's never too late to kind of change your sleep routine, change your sleep hygiene, and change your approach to getting good quality sleep for you or for your child.
hmm Yeah, I think that's an important point because I think that as parents, we start to feel so guilty. Like, I've done this to my child. Now it's too late. They're never going to be a good sleeper. Oh, well, I just have these behavioral issues. One thing always on the parent side that I'm always preaching, for lack of a better word, is about what you're doing for yourself so that you have the bandwidth to be able, once you decide, hey, I want to set things up in a way that's going to be more conducive to quality sleep, to be able to actually put that into practice, because it takes a while, right, for these habits to kind of take effect. It's not going to be overnight. Like if you put your child to bed without you with them or without all these kind of sleep crutches, it's not like it's going to be an overnight thing for them to have quality sleep. It takes a little bit of effort, right?
So true. It's like everything with our health. It's like eating right, exercise, all of those core pillars of good health. They take time, they take effort. So you really have to put the effort into sleep. And I think of sleep as a pillar that not only supports overall health, but also supports those other two things, eating right and exercise. Because if you're not getting the sleep that you need, there are various biological mechanisms by which it becomes harder to to eat what you should be eating. And it becomes harder to have the motivation to actually go out there and do exercise and energy to go out there and get that exercise that you need. So yes, sleep takes effort, but once you put that effort in and you're consistent and persistent with those efforts, usually there are improvements, both for yourself and for your children. But it's that consistency part that's so hard. Just like any behavioral change, it's so hard to be really consistent about it. But you really have to look at that end goal and keep working for that end goal. Yes, the
Yeah,
work
totally.
usually is worth it at the end.
Okay, so let's say people say, I definitely want to make a change. I want to try to get really quality sleep for my kids. Now I'm sold on the idea that behaviorally it could really help. Let's start with how much sleep does the average child need at different ages? Keeping in mind that, of course, every single child is different. So these are just
Yeah.
guidelines.
Yes, yes. So there are broad ranges, and we actually, normative data is surprisingly hard to get based on the population you're looking at, et cetera. But there was a study that was done, and this was in some of the Scandinavian countries, and they looked at the total amount of sleep from infants all the way out to adolescents. And so when it comes to infants, 1 month olds, the range here, and again, it depends on how far we look at percentiles, 9 hours in a 24-hour period, all the way up to about 18 to 19 hours in a 24-hour period. That was a range. If you look between second percentile and 98th percentile. So pretty wide range. But overall, by the time you're about 1 year of age, on average, it's around 14 hours in a 24-hour period. That's inclusive of naps. As you get older, your sleep need decreases. By the time you're hitting adolescence, we're thinking around 8.5 to 10 hours of sleep in a 24-hour period. And by the time you're an adult, it usually is between 7 to 9 hours. And yes, you have short sleepers and you have long sleepers, but 7 to 9 hours for the vast majority of adults.
Okay. And then they're going to try to get those sleep environments right as much as possible or as much conducive as possible to sleep. But then the other thing I know in parents' minds is about screens. Tell us about how screen use during the day and screen use close to bedtime, how do those affect quality sleep? And what are some principles that maybe parents can use to help to limit screens a little bit so that it won't affect sleep?
Sure. This is one of the interesting areas where we are learning a lot more, and some of the opinions are actually changing. So before we would say, particularly for adults, we'd say, you shouldn't have a screen in bed. It's going to disrupt your sleep. And there's some data coming out now that it may not be as disruptive as we initially thought. However, there's a lot of data for children that shows that the number of screens you have, the type of content you're consuming, yes, it can have a negative impact on the quantity and quality of your sleep. So for children, I still say you really want to try to minimize screen time for 30 minutes prior to bed. And there are many reasons for this. One is that just the light exposure itself, depending on how bright that light is, we think it's activating, but two, it can also decrease your natural melatonin secretion or delay that melatonin secretion. So for adolescents who are naturally predisposed to being night owls, that light at nighttime tells them, hey, it's still daytime, go to bed even later than you typically do. So that can perpetuate a kind of a bad habit. But two, the type of content that we're consuming now is just so engaging and so activating, when it comes
Mhm.
to social media, when it comes to videos, that it's very hard to put down. And it's really kind of just the milieu that's created in your brain with neurochemistry, including norepinephrine and dopamine, are not the ones that are conducive for sleep. And so for all
Mhm.
those reasons, I like to give them at least a 20 or 30-minute break when their routine starts, where they should try to be electronic and screen free for children.
Absolutely. Although I am excited about for adults, maybe it's not quite so bad for some of us.
Maybe we're still.
Maybe. I will say this. You know what's the worst for me is the morning screen time. What I have to
Mm,
do, what I have had to learn how to do is to not check my phone first thing when I wake up in the morning. It's the like having an old school alarm so that that way I'm not needing my phone to be able to wake up and then like go have my coffee, go take my 5 minutes to journal or take a shower or whatever, and then I can get into the day and what I need to do because otherwise it just starts you on that
that's right.
mode of
It's so
being
easy.
anxious. Yeah,
That's
totally.
right.
All right, what about melatonin? This is a huge one. Who is it okay for? How should we be thinking about melatonin? What are the big risks? Like, tell me what your philosophy is on using melatonin.
Sure. I always think of melatonin as a time shifting medication, not necessarily a sleep inducing medication slash supplement. So when I say time shifting, it's great for telling your body clock, your circadian rhythm, where it should be. And it's great for moving that circadian rhythm earlier. And so we have great data to support its use for circadian rhythm disorders in which you're trying to adjust your internal body clock. So that includes teenagers that have what we call delayed sleep wake phase syndrome, where they're going to bed way too late because their brain naturally can't fall asleep until much later and they want to sleep in until noon and 1 o'clock, and that's not conducive with the school schedule. That's a situation where melatonin, working with your pediatrician, may help. We know that shift work and jet lag are two other situations where the timing of melatonin can help, again, with the guidance of a physician. And there are special populations amongst our pediatric population where, for example, children that have a history of autism, we know that melatonin can help as a baseline sleep helping medication or supplement. Children with ADHD, there's data to support that might be helpful for some of them as well to help them get to sleep. But for the otherwise healthy child that doesn't have any other underlying comorbid neurologic issues or concerns, typically melatonin is not indicated. So it's an easy kind of go-to Band-Aid, but long-term, usually the solutions are behavioral in nature.
Yeah, absolutely. I have one child on melatonin. She has autism, so she uses melatonin on a regular basis. My other child, I've had to do the hard work of doing some of those behavioral shifts, making sure she gets enough exercise during the day, making sure she's not just right with the screen all day long,
Mm-hmm.
making sure that she's getting healthy food during the day so that then she can sleep, and making sure those sleep hygiene uh, parts are in place, making sure that she has a little bedtime routine, making sure that I'm lying there reading a book next to her. My philosophy is too, again, with kind of the bandwidth of parents, I always stop to think, like, what are the trade-offs and the benefits? I know that for my autistic child, the trade-off of her not having the melatonin is no sleep all night long and more behavioral issues the next
Yes.
day. I know that for my other child, if I can invest that time with her, reading the books, being with her a little bit before bed, getting that sleep routine with her, not sleeping in the bed with her, but getting those little routines going, that
Mm-hmm.
that pays off with less behavioral issues the next day. So I think you and I probably both really agree on this idea of paying attention to your individual child. What do they need when it comes to sleep? But then also, what do they need when it comes to all the things in their life? And really being a scientist,
Totally.
trying to observe and kind of collect the data yourself to say, did this work or did this make it a little bit more difficult?
Yes. And you've touched on a great point, which is, every child is so different. And so families often sometimes are blessed with a wonderful sleeper as their first child, and they think that they've done everything right. And the second child
Mm-hmm.
shows up and drop kicks them in the face. And they're like, I thought we were doing everything. And they're just naturally, some children are naturally more difficult when it comes to their sleep drive and sleep need, et cetera. And so, yes, every child is different. Even identical twins, right? They're going to have some differences when it comes to
Mm-hmm.
their sleep and their nature, et cetera. So you have to be cautious. You can't apply kind of one thing to all children in the family, and have to really make sure we kind of nuance the discussion.
So we talked a little bit about toddlers. We talked about some of those sleep crutches. And in fact, it takes time. So if you are really trying to quote unquote sleep train your toddler, give it a moment. Give it 2 weeks, 3 weeks, right? For it to really set in. But I know there's lots of people who are listening to this who are probably thinking, hold up, you missed an entire population, which is the babies.
Mm.
So I want to hear from you about what you think helps babies to sleep the best from the get-go. There are all kinds of programs out there that people can purchase that help them to get on this like particular routine. And it feels like it puts a lot of pressure on parents. So tell me kind of what are the basics of great infant and baby sleep? What do people need to know?
Sure. Well, at first I say let's set some norms and what to expect, because at different ages it's so different, right? So the first 6 weeks, it's just an absolute crap show. I mean, it is just
Yes.
torture, and people have to expect it and understand that that's totally normal. This is
Mm-hmm.
a child is not developing their circadian rhythm those first few weeks. When they were in utero, they were using mom's and melatonin to help get them on that sleep wake schedule. But then when they're out in the real world, it takes them a while for their brain to kick in and make their own melatonin. So day night, totally all over the place. They're sleeping based on hunger cues and waking based on hunger cues, and it's crazy. So
Mm-hmm.
ask for help, okay, and hopefully you have supportive environment that's helping you get through those first 6 weeks. Now, so there are two things that happen at 6 weeks. One is more sleep starts shifting towards nighttime, and around that age, babies usually start smiling at you, and so those things kind of help you move on to the next step, which is between 6 weeks and about 4 months of age, is where children are sleeping more of their time at nighttime. It's still too early to use any of the typical behavioral techniques for sleep training, based on what we typically advise, which is kind of 4 months at the earliest for the most part. But it is still an opportunity to set those great nighttime routines, start helping your child learn to self-settle by trying to get them into the crib or the bassinet while they're drowsy, not yet fully asleep. All that can be very helpful. So getting yourself set up. And some children just naturally just start sleeping really well and start sleeping through the night. A good chunk, very early, first few months, can have a stretch of 6 hours or more at nighttime. But then we're at the 4 month stage. 4 months to 6 months is the earliest in which we usually recommend considering a sleep training, quote unquote, strategy if sleep is a problem for you. And the main two caveats here is that one, you get to define what a problem is. Okay. And so if your child wakes
Mhm.
up twice at night, you feed them, they go back to sleep quickly, you go back to sleep quickly, and everybody's happy in the day, it's not a problem. You don't need to fix it, if it's not a problem for you. And number two, even if it is a problem for you, you still don't have to fix it. Nobody should tell you that you have to sleep train your child. Nobody will ever say that. No legitimate sleep expert will say you must sleep train your child. And the reason we say that is because we know that long-term data, when we look at 5 and 6-year-olds, it's not that what you do at 6 months is going to end up significantly impacting their sleep at 5 or 6, because around that age, everybody's sleep looks roughly similar. And so if this was going to set your child up for a life of great sleep, I would come down a little bit harder and say, yeah, you probably should strongly consider doing it. But we know that there are clear short and medium term benefits when it comes to sleep, when it comes to maternal depression scores, when it comes to marital satisfaction, even attachment with your child. The things that people often say might suffer from sleep training, most of it is actually, the data shows the opposite. Many, many things actually improve. So it's a safe and effective option if you so choose to use it.
Yes. What I hear you saying is you get to decide as a parent, is the current way that it's going for your family at around 4 to 6 months, is it sustainable? And if it's not, sleep training can be an option that you can use, but you don't have to. And I agree with you. That's all, like, it's not a pressure thing, it's not good or it's not bad. It's what works for you.
That's right.
I also want to point out, I hope everyone listening heard that. He said 6 weeks for it still to be messed up on the day and the night. And he said 4 months in terms of considering sleep training if you're going to do that. So, what does that mean for working moms like me, working dads like you, who need sleep, who are maybe starting to feel depressed because they have their own sleep deprivation? To me, it means separating out your own sleep needs as a caregiver from your child's sleep needs. I'm always recommending to the families that I see, if you have the resources to have a grandparent come and take care of your baby for some of the time in the middle of the night, or a friend, or if you can afford a doula, amazing. I would rather have people spend money on a doula than a fancy crib any day of the week, or fancy clothes for their baby, or a fancy bouncer. Like, there's so many things we spend money on when our babies are really young, and investing in you getting the sleep, or somebody else taking care of your baby so that you can get sleep in those early days. That's the biggest investment you can make, like you said, for your marriage, for your own happiness, and for your baby, so you can stay attached and feel happy that you had them.
Absolutely. And that final point is so critical, which is people oftentimes have this sense of guilt, like, oh, even when it comes to sleep training or getting help, it's like, I'm doing it for my own sleep. And I say, well, let's take a step back for a second.
Yeah.
One, you're helping your child get the sleep that they need, which is fantastic because they certainly need sleep. Waking up multiple times a night and having to cry and get put back to sleep is probably not fun for your infant. But number two, your sleep and your well-being as a parent feeds back into the well-being and safety of your child. We have recent data showing that mothers that are sleep deprived with infants that are not sleeping well, we think that they're less safe drivers. They tend to swerve more in the lane, they tend to speed more based on driving simulators. We know that drunk driving and sleep deprived driving, there are a lot of similarities there regarding your attention and your reaction time, etc. So getting the sleep that you need makes you a more present, more focused, more attentive, and a safer parent in many ways. So let's wipe that guilt away. Let's take some of that guilt away and realize that your sleep will feed back and help your child too.
Yeah. Remember too, we used to live in villages, in huts,
Yes.
right next to our grandma and our aunt and our sister. And this is a new thing for us to try to, like, Lone Ranger this and do it all by ourselves. It used to be that someone would take your baby and they would nurse them for you, and they would sleep, have them hold them while you sleep. So this is really, we become more and more as the generations go on, independent and lonely in our parenting. And unfortunately, it translates into infant sleep and paternal sleep in those early days as well. Yeah.
Absolutely. Yeah.
One thing you mentioned also is guilt around sleep training. I know that you had a difference with your wife in terms of, like, how you were able to handle sleep training with your own little one. And my husband and I definitely had a difference as well. My first child, I remember sitting outside the door, like sobbing, feeling like such a martyr. But I want to remind people, you do not get brownie points for being the martyr outside the door while your child is sleep training. So if that's something that you are interested in doing, you think it's not going sustainably in your family, but you can't handle it, please pass the torch, buy somebody a bottle of wine to do the sleep training for you for the first couple of nights. Do you agree with that?
That's a very interesting approach, which is maybe we can normalize, like having like friend sleep training parties, where we
That's
have a
what I did the
responsible
second
adult that
time
comes in
around.
and we
That's
can
what
have,
I did.
I like that. Yes, we talk about like throwing baby showers. Throw me a sleep training party at like 6 months,
Please.
right? Yeah, I like it. I like it. Yeah.
Yeah. Yeah, because a lot of times, of course, especially if you were the person that birthed your child and you are feeling especially guilty about this moment of having this separation or having this sense of you not meeting their needs, it's really emotionally draining to hear your child cry for an
Absolutely.
extended period of time. And so, if that needs to be your partner that does that, if you have a partner, or it needs to be someone else in your village, doesn't have to be paid off with a bottle of wine, but if there's somebody else you could have help you, I always recommend that.
Absolutely. And the main goal here is if you have another caregiver in the home with you, if you have a partner, be on the same page from the get-go. Find a technique, of which there are many, the extinction technique, AKA cry it out or CIO. That's one technique. There are many techniques that you can use to help sleep train a child. Some that are gentler, that can take a little bit longer, but are gentler in nature. Find one that you both agree on and stick with the plan. I think the way that you communicate with one another and your dual mission and being consistent is probably the most important prognostic factor regarding whether it's going to work or not. And so, yes, be on the same page and work together and communicate.
Okay, so one other topic that I wanted to make sure we covered, we have summer coming up. Some folks are already into summer with school out, and people are going to be traveling with their kiddos.
Yes.
For the young kids who might have a hard time with transitions, let's say to a back and play or to a different time zone, any recommendations you have for parents traveling with little ones, toddlers, or older kids when it comes to sleep?
Sure, I say don't do it. Just don't travel. No, I'm kidding. No, you can travel. No, it's tough. I mean, the more time zones you change, the harder it can be. There are a couple of options here. If you're traveling and it's just a few time zones, I always say it's nice to actually have one watch that sets your home time, so that you don't have to like do too much math and be like, what
Yep.
time is it over there? That explains why my child is acting this way. It's actually
Hmm.
9 o'clock back home, even though it's 6 o'clock here in California. No wonder they're getting tired. So a couple things. One, I always say take a little bit of your routine with you. And so, if they have that favorite blanket or that, favorite toothpaste or, favorite book that you read at night, try to take a little bit of that with you. So there's some familiar things in their new environment. Try to go through that routine right before bedtime. Try to keep their timing lined up within reason. And so if you're traveling just a few time zones, you might say, oh, we're just going to try to adjust the new time zone. If you're traveling really far, you have to be a little bit more wary. You can try to adjust a little bit before you leave, depending on which direction you're flying, or you can try to adjust once you're there slowly. But it's infants and toddlers, they're going to stay on their schedule, and they don't care what time it is on the clock. They're going to abide by the master clock, which is their circadian rhythm, and it will take them a while to change that. So you just have to keep that in mind. You might end up traveling to a place where it's totally fine to wake up super early and go to bed super early. That might work for you. And you stick to the same time zone, like the sleep timing that you were doing back home. That might work out well. So think about not adjusting anything and sticking with their
Hmm.
same timing.
Yeah, absolutely. And how about sleep environment? Do you recommend if people are going on a trip that they try putting their baby to sleep if they're eligible to be in a pack and play, weight wise, size wise, to sleep in that pack and play a couple nights before they even leave for the trip? Do you find that that's an effective technique?
You can certainly do that. I'll tell you that once they're in a new environment, it's still a crapshoot. It's like, they're going to be in a new place, seeing different
Hmm.
things, and even if they've got accustomed to pack and play, it's still going to be more challenging. I always say you have a sense of what your child's temperament is and their tolerance for new and exciting things. And if you find that your child is going to need that acclimation earlier, definitely get them used to it in their home environment first before you're going out on that trip. If they tend to be really easygoing and a great sleeper, you might not really need to do much of anything, and they'll go there and be totally fine. And so I say adjust it based on your child.
Awesome. All right. As we wrap up, I want to hear, because again, like power to the people on social media are the ones telling us what they actually want to hear about and what they're stressed about. What are some of the questions that you are getting from your followers or that you're getting from your patients that you want to make sure people are clear about? What are the big things, either misconceptions or things that people are constantly asking you about?
I always hear about sleep training being toxic or detrimental to the well-being and
Sure.
attachment of children. We've touched on this a little bit, but I will tell you that the debate around sleep training is purely kind of social media driven, honestly. When it comes to the data, when it comes to empirical data on sleep training, there's no real debate. I mean, it's safe, it's effective, and there is no data when we look 5, 6 years down the road that it causes any harm. When we look at a variety of metrics, when it comes to well-being, their attachment, anxiety scores, et cetera, et cetera. So, so just understand that a lot of the emotion behind sleep training and a lot of the debate, it's not based on actual data. It's based on emotion and and social media misinformation. So I think that's one. Number two, I always like to emphasize how much of a range of sleep there can be that's still normal. And so people are oftentimes hearing, oh, this is the wake window my child should have, or this is the number of
Yeah.
hours my child should sleep. And understand that it's totally a range. And your goal should not be looking at what other people tell you should be doing, but how your child is doing. Listen to your child. If your child is happy and thriving and doing great, but they're sleeping 1 hour less than what the experts, quote unquote, tell you they should be sleeping, well, then they're doing great. They're doing great. And so I always say, don't feel that pressure to make them fit into any particular bin, because there is a range of normal. And so always keep that in mind. And the third thing that I like to always emphasize is that we're always in this epic search as parents to find that one perfect way of potty training or introducing solids or the right diaper or the right way of disciplining. And it is wrought with like just hand wringing and tears and anxiety and guilt and shame. I will tell you that there are, even as a sleep doctor who has my thoughts on what the right and wrong way to sleep, there's a million right ways to do it. Even when it comes to sleep, there's a million right ways to do it. There's a million right ways to raise a thriving, happy, healthy child. And so don't feel like you have to find that one magic solution. If you're happy, your child is happy, chances are you're doing a great job. Always keep that in mind as a parent.
Oh, I love that one. So, yeah, let me zoom out, because all three of those things come down to anxiety. They all come
Yes.
down to worry that we're not doing a good enough job as parents, worry we're not doing it right. And like you said, social media, the messaging we get from the news, I think the emphasis that we have on like good or bad parenting from all the parenting books that we have out there make it feel like it's very binary, when in fact it's all about you and your child and what works. So when you feel that anxiety come creeping in, two things: recognize anxiety loves control. So when you are trying to say like, okay, what's the way I control this? I do a sleep wake window that's exactly this, or I get exactly the right diaper, or I do exactly this right thing for potty training. Just recognize that's where that comes from. And that helps so much to alleviate the pressure. And then look around you, because I guarantee you are not alone in that anxiety. Everybody feels it. So the more common humanity, the more we can feel like we're not alone, and we're going to kind of break free of that rhetoric and be the parents that are just the right parent for our own kids and for our own parenting experience, the better.
Absolutely. I love it. Absolutely. Yep.
Awesome. Thank you so
Cool.
much for being here. Will you tell listeners where they can find out more about you and about the amazing sleep resources that are evidence-based, which is what we always want, that you provide?
Yeah, so I am out on any social media platform where social media is consumed. So I'm that sleep doc on Instagram, TikTok, YouTube, Facebook, you name it. And I try to give as much information as I can that's evidence-based, that's practical and approachable, that will have hopefully a meaningful chance of helping you and your family sleep better.
Amazing. Thanks again so much for being here.
Absolutely. Thank you.